name's Dr. Kidel. I'm one of the anaesthetic registrars here at the Royal Free Hospital, and I'm making a brief video here just to remind you how to use our cell salvage machine, which is the CATS device that we use here at the Royal Free. Just before I go through it, just a brief reminder of the indications and contraindications of when to use this machine. Okay, so first of all, just to remember, you don't need to set up the whole machine first of all. What you can use is just a collection reservoir, which is this device here. We can use this just to collect blood without using the cell salvage machine itself. It's quite useful because if you've got a limited number of cell salvage machines, then you can just use this and only use the cell salvage machine when you have sufficient volume to run it. So this, if you're using this stand, just clips into this holder nicely here. The yellow port attaches to suction, and this is the tubing that's passed. It's in a sterile set, and it should be passed in a sterile manner to the scrub staff or to the surgeon, and they take this end, which connects to the Yanker sucker, and they pass the other end back to us. And we then connect this end to any one of these blue ports. This one has got the lid taken off already, that goes in the blue port, and the other end here connects to the anticoagulant, which is the ACD fluid that we use. I'm not going to open it because I want to save it, but it will just connect up here like this. To prime it all, open this up so that the sponge-like filter inside this chamber is saturated, and then until we get about 100 mils at the bottom of the reservoir, then can slow the drip rate to about 1 drop a second. If the rate of blood that we're collecting increases, or if clots start to come through, then you can just increase the drip rate. That can be titrated and tailored according to the needs. Okay, once, as I said, once we've decided we've got sufficient volume in here, we can run the cell salvage machine, which is this here. To set this up is really simple. When you plug it in and turn it on, you should get a screen like this saying install set. This has inbuilt software which talks you through everything with nice pictures. To go through that, to go through the self-setup procedure, you press this button here. This screen's not a touch-sensitive screen, you have to press the buttons next to it. So it talks us through it with diagrams, and it's very straightforward and simple. So first of all, press open centrifuge lid, which is this here. And we just open the centrifuge lid. And we get the packaging here, which is this is the auto transfusion set. This one's already been opened, so we don't have to waste money using new sets. And if we scroll down here, on the device itself, it has a picture, and it will have pictures throughout the program telling us exactly what to do. It tells us which way around to place this set, okay? And it sits nicely. If we put it that way around, it sits quite nicely and just nestles into there. So if we go back and press down arrow, hang the reinfusion bag on the IV pole, pressing down again gives us another picture. This is the reinfusion bag. So this is the bag in which blood that's going to be transfused is pumped into after it's been washed and filtered. So we can put that on the IV ball there. Next instruction, pushing down. Hang the waste bag on the right-hand side. Again, it gives us a nice picture just demonstrating how to do that. And this is all packed in the order in which it should come out. So it's sort of, they call it parachute packing. Okay. I've tangled it slightly when I repacked it last time. So we just unfold it so the writing is on the outside. Hang it onto these little pins here. Okay, and then you just make sure that this tap here is closed, which it is. Next stage, scroll down, place the bloodline and saline band on the handle. So that's these three, it shows us which three they are on the diagram. But to show you, the red one with the red clamp is the bloodline, because the red is for blood, and the two other ones are the white ones, and they're for saline. And we just hang them, we unfold them, and hang them onto the handle at the back. And again, there's a picture, just showing us how to do that. Next thing, we're going to insert these things here called the pump adapters into the pump bed. Okay. So the pump adapts to these round things, and to take them out, it's worth just stabilising with the other hand onto this round device here, and just slide them out, and there's quite a nice hard plastic bit here to hold it with. If I turn it round, you'll see there's a little hole at the back of it, and that hole is going to go onto the pin at the top, which I'll show you in a second. So to get it onto that pin, we just rotate the whole box there 90 degrees, and then here's the pin I was talking about, just at the top there. Okay, so it just goes on to the pin there. Push it down nice and firmly. It's tempting to start pushing these tubes in, and you don't need to. All you need to do is just load them and just get them in position and ready. Okay. We go back to the instructions. That's a picture of us just pushing it into place. And then it tells us how to load. It says we press load pumps, and you need to keep your hands clear because they can get injured if you don't keep them clear. So you press the button here, load pumps. And if you have a look at how it loads, at the top, pressing load now, and they just load quite nicely by rotating. If one of them don't load, you can just encourage it and press load pumps again. Okay. The next instruction is number 8, to rotate the centrifuge pump around with the cutout facing towards. And what it means by that is this drum here that looks a little bit like a lavatory seat. And to rotate it to the front, it just rotates freely around like that. Okay. Next instruction, as we come down, take the washing chamber out and with the centrifuge tubing. Now this is really important. This is the washing chamber here. And it's really important that we don't twist the tubing here at the side. And in order to reduce the chances of twisting the tubing is to pick it up all with one hand. So that's just with the right hand holding the box in your left hand and holding that tubing there. You just lift it out cleanly, get rid of the box, and then angle it down so it fits in, and allow that just to pop into place with the tubing coming out here through that gap at the bottom. Just let that pop into place naturally, like so. Okay, once we've done that, it gives us a picture to remind us how to do that, which I've just done. And we insert the washing into the rotor, which we've done already, without twisting the centrifuge tubing, which is obviously very important. And another diagram. So it's all self-explanatory. Then we press the lock chamber button. Okay, so that was, so we just, that allows it to fall in place. And then we lock chamber. The way to check that it's locked is you just can lift it very slightly with your hand there. Okay. That's a picture of us manually checking. So then we insert the centrifuge adapter, and that's that little white device that goes in there. Showing you again here. There's a little groove at the front which faces away from us when we put it in, and it just slides in nicely down like that. Okay. And if you scroll down to the next set of instructions, arrange the tubing set on the machine and close the centrifuge lid without trapping the tubes. So all it means by that is when you close the lid, make sure that none of these tubes are going to get caught on the corners here, for example. And you can close the lid and push it down at the front so that it locks, because that's where the locking device is. Connect the saline with the white spike and the blood reservoir, and then we can prime it. So the white spikes, as I said before, are these two. They collect a litre bags of saline, and the blood tube is this one because it's got the red clip on it for blood, and that just connects to the bottom of the collection reservoir there. Once it's connected, you can open the clip there. Okay, and then it's straightforward. You just press prime. So to get to prime, press return, and there's the prime. Okay. I'm going to go without priming, so no prime because I'm not setting it up for use now. And we can select a program. This is defaulted to emergency wash, which is only really used if you want blood very quickly, if someone's bleeding very heavily. What we default to is something called quality wash on a routine basis. The low volume wash is the one we may use, and that's for paediatric patients. Once you press enter, it'll start. So when the washing cycle is completed, blood is collected into this bag here, and your giving set can be attached to this port here. In obstetric patients, it's really important to remember that we have to use something called a leukodepletion filter, and this is an example of the one that we use here on this trust. In these patients, we use two suckers. One is for amniotic fluid, and one is to collect the blood in our blood collection reservoir. And this just connects with one of these spikes coming here, and then it comes through the filter, and then this is attached to the patient. The importance of these filters is that they remove fetal squames, which are responsible for amniotic fluid embolism. They can also be used in patients with sepsis, extremely important. Important to remember also that this doesn't remove fetal red blood cells. So if you have a mother who is rhesus negative and a baby that's rhesus positive, the mother will require an increased dose of NTD. This is the responsibility of the obstetricians, but it's worth reminding of this always. These are also, the disadvantage of these is that they reduce the flow rate of blood considerably. There are a few isolated case reports of these, of people having anaphylaxis, possibly to something in the filter. But overall, they're essential and mandatory to be used in the obstetric patient. So I hope this has been a useful reminder of how to set up and use our cell salvage machine. Enjoyed watching.